What is auditory rehabilitation? Auditory rehabilitations are the interventions that optimize the daily communication abilities for an individual who has hearing difficulty. Basically, it is aimed at minimizing and elevating the communication difficulties associated with the hearing loss. Sometimes we use the terminology habilitation rather than rehabilitation. Habilitation is for the infants who are born deaf, so they never had the hearing experience in their life. Rehabilitation is used for somebody who could hear earlier and have now become deaf, and you have to rehabilitate them. There are various ways and means of helping the people with hearing loss. We can use different types of hearing devices. We can do counseling. We can help them how to use the visual cues in order to hear. We can do auditory trainings, environmental modification, and various communication strategies. Rehabilitation of the hearing impaired consists of using instrumental devices and some trainings. Instrumental devices can be hearing aids, which can be air conduction or bone conduction hearing aids. It can be implants such as the cochlear implant or the auditory brainstem implant. It can be assistive devices such as assistive listening devices to hear in the noisy environment, or alerting devices. For example, the dog. You train the dog to bark if there is a fire. So for some alarm or some when there is hazard, when there is risk, or sometime to read the SMS, email, text. Also, you can use some telecommunication devices. And sometimes you can do some training in order to for example, lip reading. Rather than hearing, you do lip reading and communicate. Some people, they talk like normal fellows with the lip reading alone. They're so perfect in it. We have few in the deaf school in Paro. We can sometimes use sign language in order to communicate. So today we'll be discussing more about the instrumental device for rehabilitation. So hearing aid can be conventional hearing aid, or it can be digital hearing aids, or it can be bone anchored hearing aids and other implantable devices such as electromagnetic and piezoelectric currents. Conventional hearing aid can be body worn or spectacle worn, and digital hearing aids can be behind the ear, in the canal, completely in the canal. And there are bone conduction hearing aids, or the bands, the headbands. So although cosmetically appealing, the in the canal and completely in the canal sometimes do not give as much magnification as the body worn. However, the technology is changing and more smaller hearing aids are being produced these days. The conventional hearing aids, it helps in magnification and there is no operative risk involved in it. However, it has feedback mechanism. Feedback is basically, when the sound passes through a narrow pathway, it gives some musical sound. So that high pitched sound will be produced. And occlusive effect is when you put something in the air canal, it gives a sense of occlusion. So the air basically vibrates between your hearing aid and the eardrum. It's also cosmetically not very appealing, and sometimes it leads to collection of wax medial to the hearing aid. If the air is continuously discharging, then you cannot use the air mole in the ear. If you have unilateral hearing problem, then what you do is cross hearing aid, that is the contralateral routing of the signals. Here what you do is you put the hearing aid in the ear that is deaf, and you cross over that to the ear that has the normal hearing. So sometimes use bicross. Bicross is used if there is other side is also having some hearing problem and you amplify the sound in the other ear. And in the cross, the one ear is normal, so you basically just transmit the sound from one ear to the other. As you can see, the both the ear will have devices here. So the disadvantage is even the normal ear, so they will have a device issue you have to put there, and cosmetically it may not look very good. And although you are transmitting the sound, it doesn't give that binaural hearing benefit will not be there. You are basically just transferring sound from the deaf ear to the normal ear. This cross has some limitation, some other limitations, such as suppose if there is a sound in the deaf ear, some abnormal sound like thunder or wind blowing, that will be transmitted to the normal side. So even if you are speaking on the normal side, they may not hear sometime. These are the bone conduction hearing aids used in children. Small kids, basically the thickness of the skull is very thin. You cannot use Baha. So these headbands will be very good for them. And the thing is that it has to be worn tightly, attached to the bone, and it may cause pain, and the compliance may not be very good. And it is also not very effective in the sense that the tightness between that band and the bone is not usually maintained. So as they grow older, uh, they can be converted into Baha. Here, either they have microtia or something, so you can use the air conduction aid, or they are continuously discharging. So bone conduction aids are helpful. This adhere aid, this also doesn't need surgical intervention. We have one child with this adhere aid, Paldenas fit in. Here, the glue is used to attach this hearing aid to the masted bone, and that vibrates the bone. Baha is bone anchored hearing aid. This is a surgically implantable device in patients who have microtia, atresia, or continuously discharging one sided hearing loss. Then probably Baha would be an effective way of amplifying their sound. In a way, it also acts like the contralateral routing of the signal, because when you use a Baha implant, it vibrates the whole skull. So the normal as well as the one with the reduced hearing, both will be basically vibrated and sound will be amplified. So these have the advantage in the sense that the head effect or the shadow effect will not be there. Head shadow effect will not be there. So the time required for the sound to travel from one side to the other, because of the head comes in between, that will be eliminated by this Baha. So Baha consists of basically the implantable inside device, titanium fixture. Then there is an abutment that is fixed and comes out of the skin. To this abutment, you put a sound processor. So it consists of three parts: inside the fixture, then the abutment that comes from the skull bone to the skin outside, and the sound processor that fits to the abutment. Sometimes the abutment gets infected, and lot of care of that abutment has to be done. Baha is basically nothing but it is a surgically implanted abutment to transmit the sound by direct conduction through the bone to the cochlea. In the process, it not only conducts to one cochlea, it will transmit the sound to both the cochleas. There are also other types of implantable devices that use piezoelectric currents and electromagnetic hearing devices. OSIA is an example of piezoelectric current. In OSIA, what you do, you fix the implantable device in the bone, and the processor need not be behind the ear. You can just keep it in pocket, and the piezoelectric current, because of that, the bone vibrates and the transmission goes to the cochlea. In vibrant sound bridge, it uses a electromagnetic device that basically the sound goes, and you can put vibrate the incus here. For example, this device is clipped to the incus, and you bypass this all the air canal and the eardrum, and then you can directly vibrate the incus and the stapes. So it is a very good device for unilateral deafness. Of course, this needs surgical intervention. Some people, they don't like cochlear implant in the sense that you have to sometimes it leads to destruction of the residual hearing. So some patients, they prefer the vibrant sound bridge, because cochlear implant does not always preserve the hearing. So these are different types of bone conduction devices. Adhere, no need of surgical intervention. It plus ossia, piezoelectric current. Bone bridge, use the electromagnetic current. And Baha is surgically implantable device that vibrates both the cochlea. And it is very useful if there is persistent discharge, and you can use the air conduction aids. The next is the cochlear implant. Cochlear implant, implantable device can be cochlear implant or brainstem implant. In the cochlear implant, it consists of an outside microphone and speech processor. Then there is a transmitter by means of the magnet. It will transmit to the internal component. Component consists of the receiver stimulator, and from there the current goes to the electrode arrays that goes to the cochlea. So the external component, which consists of the speech processor and the transmitter. Internal component consists of the receiver stimulator and the electrode array. Electrode arrays are the ones actually going into the cochlea. So this is how the cochlear implant works. So cochlear implant can be implanted by various techniques. One can be the posterior tympanotomy, and then you can pass the electrode array through the posterior tympanotomy. Some use Varia technique. In this, the suprametal through the air canal, they basically pass into the round window. The outcome of the cochlear implantation is not same for every individual, and it doesn't like work like spectacles that you give amplification and it works. The outcome depends upon the whether they are prelingual or postlingual. Postlingual, they tend to do better. Younger age of implantation, they do better. If there was prelingual language development, they tend to do better. And neuroplasticity, usually in the smaller kids, if you do, the outcome will be much better than implanting in a 5 6 year old child. Thorough evaluations are done, imaging is done, make sure that the cochlear nerve is present. And even after the implantation, you have to do post-operative mapping to see what is the best suited stimulus that can be given at a comfortable level, and he hears the best. And they have to come for frequent training because they have to learn how to hear the different type of sound and convert it into speech. Cochlear implant is a surgical procedure, so it has its own complication associated with the surgery. Sometimes use auditory brainstem implant. Here, basically, you are planting in the lateral recess of the fourth ventricle in the foramen of Lusca. Usually, in cases of vestibular schwannoma, sometimes the cochlear nerve is already damaged. So, if the cochlear nerve is damaged, the cochlear implant will not work. Here, you have to do the brainstem implant. So, in the lateral recess in the foramen of Lusca near the flocculus, between the dorsal and the ventral auditory nuclei, they put a mesh. So this is how it differs from the cochlear implant. Cochlear implant has an electrode array. Here you put a mesh in the foramen lusca between the dorsal and the ventral cochlear nucleus. And because it has already bypassed, the tonotropic arrangement starts from the cochlea, which frequency sound, frequency coding, everything is done at the cochlear level. So by the time you reach the brainstem, lot of processing has already been done. Because of that, the brainstem implants are not as good as the cochlear implant. Sometimes they can only help in sound, and it doesn't really work like the cochlear implant. Sometimes the speech may not develop. So basically, it sometimes is restricted to recognition of the environmental sound. But for example, somebody has a big acoustic neuroma and cochlear nerve is damaged. Rather than having no sound at all, maybe a brainstem implant with some sound is better than not hearing anything, at least the danger sounds or alarms or something. So these are the various types of instrumental devices in order to amplify the hearing. So it consists of the hearing aids, which are of different types: body worn, behind the ear, spectacle types, in the canal, completely in the canal, or it can be bone conduction hearing aids, or it can be, we can use assistive devices in order to help in hearing, or we can use implantable devices such as the bone anchored hearing aids, OCA, or we can use vibrant sound bridge, or we can use